This is just a brief talk on the different types of evidence. A single original study is the most basic form of research evidence, but it's a good one if the study has been done well. However, the more the problem has been researched, the better the evidence, because replication lends greater support to the findings. Here are the different levels of research, and note that original studies appear on the bottom. So does that mean we shouldn't use them? Not necessarily, because some studies discover amazing things, and practice does change after only one study. However, it is better if the results can be replicated, especially if they can be replicated in different populations. You can see that if the same results appear time after time, study after study, then those results can be considered pretty darn reliable. So, original studies. There are basically two main types of research studies, qualitative and quantitative. And as we talked about, there are different types of qualitative studies and different types of quantitative studies. You should look at the chapters in your textbook on each type of study so that you can see the main differences. As we have discussed, even though randomized controlled trials, which are basically quantitative studies, appear at the top of the pyramid in the level of evidence, as we have discussed, both types produce valuable evidence for practice, both qualitative and quantitative. And since nursing is a profession of caring for humans, we do need qualitative evidence to inform our practice. So what is a systematic review? Well, basically, it's a study of studies. It's a narrowly focused synthesis of research findings from a number of studies. This particular report looked at the methodology of all the studies, and it follows a set of guidelines. So if somebody wants to write a systematic review and publish it, they have to demonstrate that they have followed a specific plan for that systematic review. And that makes that systematic review really useful piece of evidence, especially if they can demonstrate that they did it well. So what are the steps involved in a systematic review? Well, initially, you have to look at it as almost a research project. It's a research project of researching research, basically. But you want to think initially about what is the purpose of this and what is the scope of this systematic review going to be. An example is I'm working on a systematic review, and I needed to identify why I was going to do the systematic review. I'm working on a systematic review that is looking at how the chronic sorrow model has been used to study parents of children with chronic illnesses or disability. That's the purpose of my integrative review. And where I'm struggling a little bit is identifying the scope of that. How large or narrow is my scope going to be? Am I going to look at all ages of children? Am I going to look at just mothers or fathers or both parents? Am I going to look at research that's been done more than 20 years ago? So that's what would be, answering those questions would be how I narrowed the scope of my systematic review. I have to develop specific questions about what I want to know. So my first question is, how has the chronic sorrow model been used? But I'm probably going to add additional questions like, what instruments were used to measure the results? What types of qualitative studies were done? So you have to include specific questions, almost as if you were doing research. But instead of studying the problem in a population, I'm studying the problem in the literature. I'm looking at all the studies that were done on this topic. And then I have to basically write it up. I have to put all my results on a table so that I can show my readers what I found. And I have to synthesize the results. I may need to contact the authors, but generally you should not have to do that. And I'm going to have to critique every study that I read to make sure that it's scientifically valid. If not, why would I include the results of that study in my systematic review? Because if I'm trying to write up a systematic review, I'm trying to develop a research report that consumers of research, which are you guys, the people who are providing care to the patients, something valuable for them to read. If my systematic review gets published because it was done well, then anyone that's interested in my topic can read my systematic review and they'll know the answers to the questions that I asked. Will save them from reading all the studies that I read to write this systematic review. A type of systematic review is known as an integrative review. And that just means that in reviewing the studies for the paper, the author looks at all types of research, not just quantitative and not just qualitative. So in nursing, integrative reviews have become really important because, as I said earlier, nurses tend to do a lot of qualitative research. Because when you're dealing with patients who have feelings and emotions and who live a life, we need to know what things feel like and are like for them. We can't just measure things like blood pressure and rates of infection and things like that. We need to measure. We need to study what it's like for a patient to have an illness, what it's like for a patient to receive care, what kind of issues patients are looking for. So nurses tend to do a lot of qualitative research, and we do quantitative research too. So if we're going to look at all the research on a particular problem, it's probably going to include both qualitative and quantitative studies. So integrative reviews, which include both types of studies, are becoming popular in nursing. You may find an integrative review when you're doing your lit search on your PICO question. And if you find one, it's a great thing for you to look at because it's looked at a number of studies. It's a little more complicated to appraise an integrative review because you need to know what method they use to write the integrative review. So in many ways, even though for a real live evidence-based practice project, an integrative review would be one of the best types of evidence to find. But for your paper, because you're just beginning to learn how to read research and to appraise it, it'll be simpler for you to just find original studies. So I just want to make sure I get the message across to you that an integrative review generally is a better source of evidence than an original study. But in order to appraise that, it's more complicated. And I'm not sure we have the time this semester to do that. So what you might want to do if you do find an integrative review is look at the bibliography at the end of the article and find some of the articles that they reviewed and read those original studies and then use those in your paper. I'm going to skip this slide because integrative reviews basically include both qualitative and quantitative. A meta-analysis is a type of systematic review that just looks at quantitative studies. So a meta-analysis is considered a very high level of evidence. It looks at quantitative studies that have a lot of rigor, generally controlled, randomized controlled studies. So you can imagine that if a randomized controlled trial, an RCT, is considered a high level of evidence, then somebody that writes a paper on a bunch of RCTs and synthesizes the results all together, you can see what a high, rigorous type of evidence that is. So meta-analyses are generally considered a very high level of evidence, and they're difficult to write. They're challenging. They take time. It's like doing a study in a way. They have to follow a particular format, like a cookbook, like a recipe. They have to follow a protocol for how to write it. If it's not written according to a sound method, then it is worthless. So writing meta-analyses is hard work, and usually is multiple authors on those because it really is a large endeavor. And because it's such a huge piece of work, there aren't a ton of them out there. And certainly it would make sense if you think about it. If it's a new problem and a problem that hasn't been studied very well, then there's definitely not going to be a meta-analysis, because a meta-analysis is pointless to do unless there's a lot of studies already done. The whole point of a meta-analysis is looking at all the research that's been done on one problem and analyzing it. So meta-analyses can be found on problems that are old to the medical profession, like the effects of Tylenol, or Tylenol compared to ibuprofen, or something that's been looked at for years and years. Then you'll find a meta-analysis on something like that. And not common in nursing, really, because they're too scientific, and nursing is part science and part caring. So again, the meta-analysis, reports on a large sample, because if they look at 10 studies and each of those 10 studies had a sample size of 50, then it's almost like looking at the results of a sample of 500. So you can see where a meta-analysis really increases the rigor of study findings, because it combines all the results from all the studies, and if they're all the same, then it's a really strong piece of evidence. A meta-summary is sort of a study of just qualitative studies, but meta-summary is not a term that I'm familiar with. I'm familiar with metasynthesis as the term, which is a study looking at a bunch of qualitative studies. My integrative literature review that I'm writing is going to be similar to a metasynthesis, because most of the studies I'm looking at are qualitative, but because I am looking also at quantitative studies, mine will be an integrative review. So how do we determine the best evidence for use in practice? Well, the strength of evidence is on a continuum from high quality to low quality. And part of the way that we know that a study is high quality is by appraising it. And we're going to be doing that, in the next couple of weeks. Not only are you going to learn how to read research, but you're going to learn how to appraise it, at least a beginning appraisal, so that you can sort of make a judgment about whether it's a well-done study or not. It's hard because if you're just beginning to read research, you aren't really an expert on knowing whether it was done well or not. But this is a beginning endeavor for you in this process. Once someone has looked at all the evidence on a particular problem, and they've synthesized the results, then they are able to write up a practice recommendation. And practice recommendations are really what an evidence-based practice guideline is. So evidence-based practice guidelines are essential in developing evidence-based practice in nursing. And EBP guidelines are developed once all the literature on a topic or problem has been reviewed, synthesized, appraised, and turned into a recommendation. Nurses should be basing clinical care decisions on published guidelines. If there are none, then an EBP project is in order, and that's what you all are doing. Let me know if you have any questions. This is the end of the slideshow.